Dr. Joe here. In today's video, 4 medications not to use with your vitamin D supplement. The reason? Well, if you use them together, then you're not going to get the desired effect from your vitamin D supplementation. So it's best not to use them together. So 4 different medications. We're going to dive in now straight away. So it's 4 medications not to mix with your vitamin D. The first one is steroids. Okay, steroids. Obviously, steroids are a group of medications. It's not just one type. Why don't you want to mix your vitamin D with your steroids? Well, it's because steroids do reduce the absorption of vitamin D, okay, from the gut. If the absorption is reduced, well, obviously, the net effect of that is that you're going to have lower levels of vitamin D. You're not going to get the desired effect. One reason why you may be taking your vitamin D and the levels are still low, okay? Do not use steroids and vitamin D together. So that's number 1. What's number 2? Well, number 2 is Orlistat. Do you know what Orlistat is? It is a weight loss medication. It used to be very popular. It's not as popular as it used to be those days because of the newer medications like Ozempic, Wegovy, Mounjaro, and Saxenda. They're all there now, so it's got competition. But the main thing about Orlistat, why it worked for weight loss, is because it is a fat blocker. Okay, it is a fat blocker. It stops the fat in your meal from getting absorbed. Obviously, if the fat is not getting absorbed, it's going to come out the other end. We had a nickname for Orlistat those days. We called it Orlistat because of what it does to your number 2. And sometimes it does stain underwear. Anyway, if it's stopping the fat from getting absorbed and vitamin D needs fat for absorption, then obviously the vitamin D you take with the Orlistat is not going to get absorbed. So you end up with lower levels of vitamin D. So Orlistat and vitamin D, no, they don't go together. Please, okay? That's number 2. Let's move on to number 3. What is number 3 medication you don't want to use with your vitamin D? It is Thiazide diuretics, okay? That's another group of medications. An example will be hydrochlorothiazide. What do they do? Well, the idea behind Thiazide diuretics is they'll help you pee more to contract your blood volume. That way, it will lower your blood pressure. So they are mainly prescribed for blood pressure management. But guess what they do? Thiazide diuretics, they reduce calcium excretion through the kidneys. So Thiazide diuretics, they stop the kidneys from expelling calcium in the urine. The net effect of that is you have higher calcium levels with Thiazide diuretics. So, what about your vitamin D when you take it? Well, the idea behind vitamin D, by the way, is to increase calcium absorption from the gut. That is the thing that vitamin D actually does. It raises your calcium levels, okay? Because it promotes the absorption of calcium from the gut. And the net effect of that is you end up with higher calcium levels. So when you have 2 things working together, they reduce excretion of calcium through the kidneys, as well as increased absorption from the vitamin D, you then end up with synergy, okay? You have a synergistic effect. What that means is you're going to end up with higher levels, very high levels of calcium, okay? You end up with very high levels of calcium. So you don't want that. You don't want that. Very high levels of calcium is not good. You could end up with kidney stones and what have you. So not a good idea. So that's number 3. What is number 4? Number 4 medication not to use with your vitamin D is statins, or it's a group of medications, statins. So what's the deal with statins? Well, this one, the results is actually mixed, in the sense that statins and vitamin D, they use the same liver enzyme for metabolism. So the enzyme is called CYP3A4. This is the enzyme that metabolizes vitamin D as well as your statin. So what that means is you're going to have competition between the statin and the vitamin D for the enzyme, okay? Because they all want the enzyme to work on them, and then one of them is going to win at every point in time. The vitamin D may win on one occasion, or the statin may win. So when you look at the research, what you'll find is mixed results, in the sense that you may end up with higher vitamin D levels or even lower vitamin D levels. Obviously, when the vitamin D is winning, then you could end up with lower vitamin D levels, and of course, if the vitamin D is losing, you end up with high vitamin D levels, higher than you will anticipate. And the same thing happens to the statin as well, okay? If the statin is losing, then you're going to end up with very high levels of statin. And if the statin is winning, then you end up with very low levels of the statin. So, you know, the result is mixed. So it is better you avoid that mixed picture. So those are the 4 medications. We'll go over them again. Just to summarize: steroids, number 1. Number 2, Orlistat, which is a weight loss medication. Number 3, Thiazide diuretics. And number 4, statins, which is a group of medications. So what should you do in this situation? Now, before I tell you what you should do, a quick plug. The book you are seeing on your screen now is my book on managing high blood pressure with lifestyle approach. This is the 2nd edition of this very book. Links to get the book right below this very video. Please do get yourself a copy. Well, ideally, what you want to do is take them at least 4 hours apart, okay? These medications, that's what I would suggest. The longer the interval, the better, okay? The longer the interval, the better. A minimum of 4 hours. You want to separate taking any of these medications from your vitamin D supplementation intake, okay? So, hopefully you got some value from this very video. If you did, please give the video a thumbs up. Please like the video, and also please share this video with your friends, family, and colleagues. Questions, comments down below. That's it for this video. Until next time, well, this is Dr. Joe signing out.